Yep.
What does the regulatory landscape look like? Like, what is the FDA doing? How are they looking at it? How are people like yourself interfacing with them? Like, what does that communication look like? What are the barriers to this type of technology that regulators are throwing up, and where are the green lights?
In the case of the FDA is really leaning in to learn and understand how AI could be used and how they need to be responsibly involved in regulating the application of AI. So there's a branch within the FDA looking at digital diagnostics, for example, or digital healthcare delivery to know how should that be regulated. The FDA collaborates with or funds institutions like Stanford, for example, with UCSF. We, Stanford, have a Center for Excellence in Regulatory Science and Innovation, goes by the acronym CERSI. So we have faculty at both institutions doing the science that informs regulation. The FDA funds this. They receive the reports. They're very much involved in the activities of the center. But the FDA is partnering with or gaining information from those that are doing the primary AI and healthcare work to know how they need to be involved in regulation. Likewise, the Department of Health and Human Services, through the Office of National Coordinator of Health Information Technology, is very interested in how AI is and can be deployed in medical records in the future. So I think the governmental agencies are taking a responsible approach of wanting to understand the landscape and know how they can and should be developing the regulations that absolutely will be needed. But I'm encouraged. I've gotten to know and learn from some very, very dedicated public servants at HHS, at the FDA, both through their own work and the work that they are engaged with us and other institutions in, are gaining the knowledge needed to do responsible regulation. And regulation has to be a part of this.